I think it goes back to that communication piece. We continually need to talk to folks about their experiences. What are their successes? What are their challenges? How are they communicating the message?
Most importantly, talk with your peers about the process. Don't be afraid to ask for their help, their advice. Use their templates that they have already set up. Don't recreate the wheel where it's not necessary.
And there are also excellent resources online. Fabboard.org has got all kinds of things on the nowbo.org site, APHA, ASHTO, NACHO. They all have accreditation links in them. Well, I think everybody needs to look at their individual mission of their health department. And when you connect the mission of your health department with the goals of the accreditation process, it's a natural fit. That's why I see accreditation as so important, because it allows you to do what you want to do in a quality way. We all understand that there are budgetary constraints. We all understand that there are limited funds to do what we want to do. How do we utilize those funds most effectively, most efficiently? And then how do we show the people that pay the bills that we are doing the best we can? That whole evidence-based practice thing, where we're not just willy-nilly going out there and trying things. We're looking at the evidence. We're evaluating the programs. And that's what I would encourage people to look at.
Start the process. Dig in, take your time, plan for a lengthy process. Create that to-do list. Just create something so that each of the standards, as you go through them, you can identify what needs to be done. Take small steps. Review 1 to 2 standards at a time. The first time, 2 years ago when we went through this, we looked at every standard. And when we came back and stepped back the second time around, we looked at a standard at a time and reviewed each along the way. It's helpful.
I think that this should come with a bucket of Advil for each because it's really time consuming, and it's hard and heavy work. And I think one of the biggest things about this accreditation that we need to remember is that this isn't something that we do and we're done. It's ongoing. It's going to keep going and going and going. We have to keep maintaining our standards. We have to keep maintaining our proof that we're meeting those standards. And it's going to have to be a whole new mindset throughout the health department, and that's something, so many other large projects that come by in local health departments, you do it and you're done and you breathe a sigh of relief and then you're on to the next one. This isn't like that. This is a huge project.
And I think that voluntary accreditation is just one tool that we can use to help us all as we meet the needs of the people in our community.